So there are things like hidden, right, inside the nervous system. And things like that is what we truly learn through the SCP, and I'm so grateful about it because we get a new understanding of how the body works and how we can support at that moment.
Hey, Dr. Chris Gubbels here with Health Heroes Podcast, and today we have a special guest, Dr. Yahdi Cotto with 100% Chiropractic. Welcome on the show.
Thank you so much. Thank you for having me.
All right, well, today is really interesting because this is a clinic that is bilingual, and you're not originally from the United States, you're from Puerto Rico. So I'm fascinated to know about your story and how you found chiropractic and how did you, go about, or what was the story about you becoming a chiropractor?
Absolutely. So when I was in Puerto Rico, I was actually going to med school. So I thought that was my path. I was doing like open heart surgeries, like shadowing. I was like very invested into the medical world. I was going to school to become an epidemiologist, and I had a very strong background in cancer research. So I remember one night I was calling participants for a study, and I got to talk to this person, and she said, like, you know what, I wanted to decline, like, going to this particular study because my kid has leukemia, my mom has breast cancer, and if I participate, I won't be able to take them to the treatments. And it really, like hit me like a rock because no one should like really be in that position to actually being alive or not, right? So I said, like, to me, should be something else that we can do to help these type of patients. And that's when I discovered chiropractic, about innate intelligence, the power of the body to heal itself. I just became so passionate about chiropractic. I remember going to the leadership weekend at Life University. I applied to become a chiropractor, got accepted, and then 2 months after, I was starting chiropractic school.
Wow. So it reminds me of Dr. Peter Attia. I don't know if you know him. His story, he was a cancer, not researcher, but cancer doctor, and he realized they were really helping people just at the very end and giving them just a few more months, maybe years, but they weren't really making that big a difference, and so he changed his path too. But how did you first find chiropractic then? You were looking at being a medical doctor, you realized that's not what you wanted to do, then you went to chiropractic school, but what directed you towards chiropractic?
Yes, so my sister was very interested in becoming a chiropractor since a younger age. So we got the opportunity to visit Life University during the leadership weekend. I listened to Dr. Rickman talking about innate intelligence, like the power of like the body healing the body. It just caught me like right over there because it's like, this is the answer that I've been looking for so many years. And it, the path was open for me. I got accepted into school, and I'm so glad, that moment happened in my life.
So your sister was looking at being a chiropractor, and you were kind of along for the ride, and you decided, hey, I'm going to do this too.
Exactly.
Did she become a chiropractor?
Yeah, she did.
Where does she practice at?
She's practicing in Westminster, Colorado.
Oh, I didn't even realize that. Yes, very cool, very cool. And then after chiropractic school, what was your next step there?
Yes, so after chiropractic school, I started like practicing right away as an independent contractor in a corrective clinic in Georgia. So then after that, I decided that I wanted to become an entrepreneur and actually impact the Hispanic community. I have a lot of background in correction and making sure that we are like helping people with scoliosis or these issues like curvatures in the spine. So I always was passionate about it. So I found 100% chiropractic, that it has the systems to allow that corrective care, and that's how I like became part of them.
Yeah, I think it's interesting because as a healer, I think so 100% chiropractic, there's many of them, but you still do some things different than other ones.
That's right.
And I know you guys have a real strong corrective chiropractic focus. Can you talk a little bit about, when you think about corrective chiropractic care, that can mean a lot of things to people. What does that mean to you guys, and then what specific things are you guys doing here for corrective chiropractic care?
Absolutely. So for corrective chiropractic care, like really we base a lot of our corrections in the structure of the spine. So we understand that when, we as human beings, we have the right structure equals function and health. So we do a full evaluation for the patient. We determine what areas that spine is lacking that correction or that structure. And we create individualized plans for them. We see a lot of children too, because I had the ICPA certifications, pregnant patients, babies. So we understand that the earliest that we can see that person, the more we're setting them for success in the future. So that's something that we do different, probably also from other practices.
Yeah, so my background is chiropractic biophysics, and when I was coming out of school, I was in a large clinic that was starting to learn Pedibond. And so I dabbled in that, but I realized the results were kind of hit or miss. That's when I found chiropractic biophysics. So how did you first get introduced to chiropractic biophysics?
Yes, I would say that it was through my doctor, to my PIC doctor. So PIC is an opportunity that we have in school to practice with a doctor in real life. So he was very invested into CBP and corrective care. So I became so passionate about it. I think I have a very engineering mind too, like I like science, math. It made a lot of sense to me.
Who was your PIC doctor?
It was my Matthew Eisen in Roswell, Georgia.
Okay.
Yes.
Did you know Dr. Curtis Fedorchuk in
Yes,
Georgia?
absolutely.
So he's a good friend of mine. Yeah,
he was my professor for CBP in biking
oh my God,
in school.
He's hilarious when he speaks
He's amazing,
and stuff.
yeah.
He talks about his what he was like as a teacher, and he sounds like he was very polarizing. Either you were on board or not on board.
Yes.
Okay, so you drank the Kool-Aid.
Yes.
For him. Perfect. And then you mentioned something about the pediatric stuff, because I think sometimes you see doctors on their websites that they do everything, but they maybe don't have advanced training. And I know when I had my daughter like a little over a year ago, was one of the first things I did is I actually went to someone that was certified and trained through the ICPEA, which is the International Pediatric Chiropractic Association. So there's a whole pretty intense diplomat or advanced training just in prenatal and pediatrics.
Exactly.
And I did part of that, but after watching 9 live births in one afternoon, I realized this is not for me. But talk about like, what does that mean when you're trained by the ICPA, and then also what is Webster Technique and who is that for?
Absolutely. So ICPA, I feel that they give you a very strong background in different challenging cases too, which is something different.
And what to look for and how to screen and evaluate.
Exactly, because the thing is, like many people out there can think that chiropractic for kids is the same as an adult, just like use less force. And it's actually the total opposite, right? Like adjusting kids and adjusting a baby is so different from adjusting an adult. There's so many things that you need to take into consideration.
Give us a couple examples of things that you would consider with an infant or young child that you would an adult that someone maybe doesn't realize.
Absolutely. For example, when we're doing, let's say that a mom is taking a kid because they're fighting like digestive system issues or constipation, we need to take a lot of consideration into what is happening with the hip area, and those nerves are innervating the lower region of the body.
Yep.
So we do a lot of soft tissue work like sacrotuberous ligament. They're gonna be like things that we're gonna be looking for so we can support that baby in that development. So in addition to that, when we're doing Webster's technique,
and what is Webster's technique?
Webster's is a
well, actually, let me unpack something because it's really interesting. So you mentioned with an infant, because this is common where they have digestive issues.
Yes.
And you would work on their lower back, on their sacrum, because that's what innervates their parasympathetics, or you have your fight or flight or your rest and repair.
Exactly.
So if your body is not able to be in rest and repair and you're stuck in fight or flight, your body's not going to be able to digest properly. That's kind of the idea, right?
Exactly.
So you got to basically get your body in rest. You can't be in go and relax at the same time. So basically, just by releasing the nerves that allow your body to be in rest and repair, that can help a lot of digestive issues.
Absolutely.
I have a story, and I shit you not, this is the truth. My wife, she goes to a specialist to get some her C1 adjusted because she was in a car crash and she has some instability. And that doctor was telling her about a mom that brought her baby in who was constipated. And the pediatrician or the GI doctor that they had brought to, they didn't even want to look at food. Like, we're not even going to do food sensitivity to this, or or they said we're not even going to mess with an elimination diet. But what they recommended was Botox, like rectal Botox injections, to get that to relax. And I bring this up because sometimes people could think chiropractors can be extreme by adjusting whatever, but that seems crazy to me. Yes. And from a chiropractic standpoint, it was such a simple solution. You look at toxins or foods that are causing problems and you eliminate those, and then you adjust them, and boom, problem solved. But you think how crazy, and I know that someone could watch this and think, I have a child, not sure what to do. And even like with our infant, we had a pediatrician, because even as an infant, they were recommending COVID shots and crazy stuff, and we're like, this is insane. And so I think people don't realize that infants, parents just want to do the best thing.
Yes.
But there is a great role for a chiropractic, but having someone that has special skill in treating infants is different than go to someone that just does chiropractic. As a chiropractor, my friends say, why don't you just adjust your infant? I'm like, I could do it, but like, I know I specialize in things, and I know those people that specialize in infants, and I want to take my daughter to someone that has special training and special skill just in infants, and just that evaluation.
Exactly.
So when our baby was born, my wife asked me like, oh, they did all the checks. I said, yes, but I know that they did the checks general. I felt more confident having her rechecked, even from an orthopedic standpoint, by a chiropractor that was trained in infants.
Yes. And there's so many research studies out there that are fascinating to me. For example, there's a study that evaluates kids that were born during COVID, and as we were mentioning before, the sympathetic system in the moms was so high with everything that was happening in the world. So they were noticing that those kids were left in the head way earlier than they're supposed to be. And you know, some parents can get excited because the kids is like hitting development like milestones faster, but the reality is when they did the study, they found out that it was so much tension in the body that the body was like activating the sympathetic system too early. So things like that is what we learn in ICPA, so that way you can evaluate kids better and understand what is happening really inside their bodies and the nervous system.
You think about kids, you know, infants, they spend so much time sleeping and growing, and that's when you grow, is when you're in rest and repair. So if they're stuck in fight or flight, they're not going to be able to grow and develop like they're supposed to. You may look like, oh, they're doing this, but...
Exactly. Yeah. So there are things like hidden, right, inside the nervous system. And things like that is what we truly learn through the ICPA, and I'm so grateful about it because we get a new understanding of how the body works and how we can support at that moment.
Wow. And you mentioned Webster Technique. So can you first talk about what is Webster Technique and who is it for? Yeah,
absolutely. So Webster's Technique is for, and since early on in the pregnancy, we actually can do it in other like females as well if we're finding differences in the hip area. But Webster's Technique is a technique that is gonna account what is happening with the alignment of the hip and also the soft tissue around it. So I know that there's a lot of misconception out there that it says that it's a technique for flipping babies, but absolutely not, right? So what we're doing is accommodating the hip, making sure that the biomechanics of the hip are moving so much better, so that can set for success the pregnancy, the development of the baby, and it has so many benefits, like helping the mom postpartum recovery, like less pain during labor, and there's plenty of research on this too.
So I went through the Webster Technique training when I was doing the ICPA program. And my big takeaway was understanding when you're making sure the mom's properly aligned, you're reducing interuterine restraint, which naturally allows the baby to turn less, so it does lead to reductions in breech deliveries. Is that basically the understanding?
Exactly.
So we always say from the womb to the tomb.
Yes.
Right? So a lot of people don't realize during pregnancy, if you can start getting adjusted throughout the pregnancy, you're probably set up for a more successful pregnancy, probably less likely to have back pain, but probably setting the stage for a healthier baby, better delivery. You're starting that process off from day one.
Exactly.
Which makes sense because even now if people are planning to have babies, they understand that we need to start looking at our nutrition way before we even conceive, so the earlier you start with the getting chiropractic treatment, the better outcome for your baby.
Absolutely, yes.
Yep. My wife, we had a high-risk pregnancy where she had to stay in the hospital for a little over 2 months just because we had something called a vasa previa, and if she went into labor, the blood vessels could bust and you had to be there. But I remember she was having a lot of back problems, so we busted her out of the hospital. I went down the street, I found a chiropractor who I walked in, I said, hey, can I just use your table? And I was trained in Thompson days, so we did Thompson, but then I did some Webster on her. And it was so simple, and she's like, that's it, because she used to be doing more aggressive manual adjustments, and that just a little bit, boom, like changed so much for her just from doing some of that stuff.
Absolutely, yes.
Now, one of the things you mentioned that's unique to your office is you guys are in Aurora, there's a big Spanish population, but everyone in your office is bilingual, is that right?
Yes.
So talk about that and just kind of how that helps you better cater to your specific community here.
Yes. I find that something that it was, my grandparents moved to Texas a few years ago, and it was very challenging for them because they didn't speak any English. So finding a doctor that can actually comprehend the issues that we're going through, it really sparked, my interest in forming like a very strong bilingual practice in Aurora, Colorado. And it's something that I think differentiates a lot from other chiropractors or other health practitioners in the area. That is, we can speak the language, but also understand the issues that they're going through culturally and also physically.
Yeah.
And we tailor the care for them. So we will always base everything on individual cases. We meet with them, we understand what is going on, and then we create the care plans according to that.
And that's good to know, because I always think there's two things you're trying to create. One, you want to have excellent treatment and service, but also it's the experience.
Exactly.
And that helps with the experience. If the experience is not good, which is, you know, how you feel and like the office, it doesn't necessarily matter how good the treatment is.
Exactly.
I mean, both of those are part of the healing process.
Yes, we want them to feel at home. And I feel that it's something that we do pretty well with our patients, is making sure that they feel that they belong to a place, right?
And do you guys do any personal injury stuff?
We do, yes. So we definitely like have experience from plus 9 years in personal injury cases. We don't treat them different than, you know, the regular patient, in the sense that they get the same experience and the same treatment, right, like a homey feeling. But at the same time, we're focusing on restoring the spine for those injuries that they sustain in those crashes.
And the reason I bring that up, because we do a lot of personal injury in Fort Collins, but we found attorneys that reach out, and a lot of times attorneys have a hard time finding a bilingual office to send their clients to when they need chiropractic care.
Yes, absolutely.
So if you're an attorney watching, this is your place.
Yes.
What's your favorite patient story? Do you have like one story or one thing that, like a miracle story, or just like for you, like an impactful story for you as a doctor?
Yes, absolutely. So we have a patient that he was working at the airport, and then there was a monoxide accident at the airport. So the patient fell from the ladder. He hit the head and the body. So he had multiple fractures in the spine to the point that he was left into a wheelchair. Very young patient, you know, a lot of life really waiting for him. But he felt that he was constricted into the wheelchair and he couldn't do much for his family. So it was something that it wasn't just impacting him physically, but also mentally. Right?
Wow.
So then he came over here, we did the full evaluation, and then he was like, do you think you can help me? And I was like, I never say no to a patient. I was like, we're gonna find a way to actually help you. So we started doing adjustments, you know, little by little. I remember that one time in the first table over here, he was able to stand by himself for the first time after having that accident. And he was bursting tears, and for us it was just that testimony, right, that the power of our bodies.
Say that again. So after the first adjustment, what happened?
Yes. So he got adjusted multiple times, and then it was always a challenge to get him in the table and getting him out of the table. He needed always assistance. But that last adjustment that we did, he was able to stand by himself from the table and actually stand for a couple of minutes over there without any type of assistance.
That's really
so it was amazing to see.
Wow, so that's something that'll stick with you your whole practicing career.
Yes, absolutely.
Cool.
Yes.
Now, you've been in practice for 9 years, right?
Yes.
I'm curious, as the business owner and healer, because they go hand in hand to some degree, if you can go back and give yourself some advice from when you were first starting out, what advice would you give to yourself?
Yes.
Whether as a business owner or just as a doctor?
Absolutely. I would say probably as a business owner, it's just making sure that we really create systems. I feel that that's something very important, that at the beginning of my first year, right, in leadership and also being a business owner, if you don't have the systems, you're gonna struggle. But if you have very solid systems, anyone that joins a team can actually follow them, and then it will set you for success faster in your career.
It also impacts your ability to effectively treat patients, because if things are chaotic and it's not organized, it's hard to have your attention in treating gets messed up.
Yes.
So systems actually is a big benefit to the patient too.
Absolutely. I feel that it helps us to be extremely efficient, and that's a way that we can see high volume right in our practice and impact so many other people in the community. Is making sure that if we have a very systematic approach to everything, we get the same experience to everyone, but at the same time it helps us to grow and scale in the future.
Yep. You know, at Scoliosis, we're really known for, you know, treating scoliosis cases, and we get a lot of extreme cases. But one of the things that I see a lot is a lot of times we don't get cases until the curves have gotten really bad. And although we can still usually help them to some capacity, I always think if we could have got this way earlier when it was still small and it may not have seemed like a bigger deal, the outcome would be much bigger and we could have even had a bigger impact. I'm curious, in your own practice with the kind of patients you see, where do you see that or something similar to that?
Yes, I will say that we definitely receive quite a bit of patients like suffering from scoliosis, and sometimes we are the first ones to tell them, right?
Yeah.
Like they have been to their practitioners.
They're kind of the hard, they're almost more challenging because they don't almost believe it or understand how severe, the severity of it.
Exactly. So I find that sometimes as, you know, chiropractor and probably happen the same to you in practice, like you're the first one to tell them that there's a scoliosis, and many times when you discover that scoliosis is pretty advanced. So I find that making sure that we do a very thorough evaluation at the beginning, and if we are not having the tools to help that patient, to refer to centers like more specialized on that, it will help the patient, right? It will set them for success with their health and the functionality in their daily living.
Yep. And I get asked sometimes, what role does general chiropractic have to do with scoliosis? And what happens to your spine when your spine starts to rotate, it immediately starts to stiffen up. And the stiffer the spine gets, the harder it is to change the size of the curve. But we know people, one, if they're in pain, it's going to help reduce pain naturally, but also it helps keep the spine moving, which makes it easier for us to do things with bracing and scoliosis rehab when we're trying to reduce the size of curves.
Yes.
Yep. And if you could give one piece of advice to a patient that may be watching just about their general health, what might that be?
Yes, I would say, like, don't wait to get checked, right? Because I get so many people out there when we're doing screenings and health talks, it's like, oh, but I don't feel anything, so I think I'm good on the inside, right? So it's like, don't wait until it becomes a symptom, something more evident, right, for you.
Absolutely.
Like, chiropractic is for everyone. Like, everyone that has a spine, they can receive chiropractic care. And the reality is that chiropractic, the core chiropractic is making sure that your body and your health is at its optimal. And that's something that you can do at absolutely any point in your life. And the earliest that you do it, the better you're going to develop.
Yeah,
right?
I mean,
you're going to function.
People understand, like, you know, it's like saying, why would I go to a dentist? And I don't have a toothache or anything. Well, you realize if you're taking care of your teeth properly, then from early on, you're going to be better off. But also, the dental industry has done a good job at teaching people how to take care of their teeth with, you know, with dental hygiene and flossing and brushing. People still know that it's good to go and get checked. But the difference is almost nobody has been taught how to take care of their spine properly or even where to begin, especially in technology days where kids are chronically hunched over. So you have to at least go in and get checked so you know. And we're not saying you need care, but you get checked, and then there you can see like where someone is and if something can be addressed, because all big problems start as small problems.
Absolutely. And it's something that, especially for like parents, right? Like making sure that you're checking your kids as well. Now, there's a lot of misconception of chiropractic for kids. If the chiropractic is safe for kids, it's absolutely safe, right?
Yeah.
So it's just making them like develop better and making sure that they perform better in their sports, in school, in their life. So as a parent, it's something that I never miss with my kids is their adjustments.
Absolutely. And that's even if someone is like sick, and I'm not saying you're treating the sickness, but that's my first instinct is get adjusted, because you're really just helping the body function optimally, boosting immune system, and you're really just trying to put your kid, you know, get them to be normal, right? Being healthy is normal, when a lack of health is abnormal.
Absolutely.
Right. Now you have some other services. Talk about some of the other specific things that you guys offer here.
Yeah, absolutely. So when we create the care plan for our patients, we make sure that we evaluate what is happening with their musculature too. So as a reason that we have integrated massage therapy into our practice. Our massage therapists are highly trained in correction too. So they know about scoliosis.
And you have two massage therapists, right?
Yes. Yep. So we had two. We have a stretching therapist as well. And we also offer laser therapy to speed the healing in the process. So laser helps with oxygenation, blood flow to the area where the laser is being targeted. And then it helps with the cell reproduction. So it's something that we see amazing results when we integrate it with chiropractic.
Excellent. And so if someone was watching this and they're interested in knowing more about you or your guys' practice, how would they find you or how do they learn more about you?
Yeah, absolutely. So on social media, our page is 100% Chiropractic Aurora. Same for Instagram, and our website is www.100percentchiropractic.com.
Excellent. Well, thanks for being on our show today. And if you're in the Aurora area and you're looking for a chiropractor or you're curious about chiropractic, be sure to give Dr. Yadi a call. Earlier is better, and always remember to stay ahead of that curve.
Absolutely. Thank you.
Thank you.